Thank you, Madam Chair. Good morning, members. I am joined by two guests today. We have our Health Protection Manager, Laura Anderson. That's her former title, now known as the Deputy Incident Commander in Public Health these days, helping to do the public health briefing, and then she'll turn it over to our Medical Director, Dr. Lynn Ogawa, to help with some of the update. Take it away, Laura.
Thank you, County Manager O'Connor. Madam Chair, Commissioners, County Manager, before I offer the numbers today, I just want to acknowledge that we are very nearly 6 months into our response to COVID-19 as a community. Approximately half of our department staff are active in an ICS role. This includes case investigators, public health nurses who are supporting residents in isolation with essential services, health educators doing community-based health education both for our residents and our business community, as well as staff involved in testing our residents. So on behalf of those colleagues, I am happy to present this week's update. I'm going to start with a brief overview from the state. These numbers are accurate as of 11 a.m. yesterday. Within Minnesota, our total cumulative cases are 70,298. We have 717 newly reported cases and 4 newly reported deaths. This includes a death in Ramsey County. The total approximate number of individuals who have been able to access testing in Minnesota is 1,067,810. Total deaths, 1,771 people have died as a result of or related complications to COVID-19. The majority of those deaths have occurred within long-term care or assisted living facilities, 1,313 deaths in those facilities. But we are certainly seeing increased numbers of cases among youth, and I think as the fall continues and we see schools reopen, we should be monitoring that. With regards to the numbers here in Ramsey County, I'd like to ask my colleagues to take a look at that open data portal. Here in our community, we have 8,715 people who have been diagnosed with COVID-19. The number of individuals who have been hospitalized since March is 1,055. 317 of those persons have had to be hospitalized in intensive care. 292 have died. More than half of all persons diagnosed with COVID-19 in Ramsey County describe themselves as Black, Brown, or otherwise a person of color. We now have 22% of all our cases occurring among Black Americans, 20% among Asian Americans, and 15% among Latina Americans. We do have some new additions as of last week to our dashboard. This is thanks to our colleagues in communications and planning. And this is with regards to Ramsey tests by week. Yeah, thank you. We started monitoring the number of tests that are being offered to Ramsey County residents in late June. We have continued to monitor that data on a weekly basis. I did note a small uptick in total testing counts as of August 20th, sitting at 11,824 tests that week. We believe that by increasing access to testing, we will have a better understanding of how COVID-19 impacts our residents. That positive diagnosis gives our residents more information that they can use to reduce the likelihood of transmission to their friends, family, and coworkers. I also want to point out the weekly percent positive chart, again in the open data portal. Percent positive is the quantity of positive tests divided by all tests given. We may have a higher prevalence rate in Ramsey County, or it's possible that we have some targeted testing strategies that are helping us catch positive cases sooner. It's difficult for us to know because our state, like other states, does not require healthcare to report those negative test results. As of August 20th, our weekly positivity rate is 7.6%. I am now going to allow my colleague Lynn to share some information around community testing that we have been a part of.
Madam Chair, Commissioners, County Manager, thanks for having us here. And my colleague Laura alluded to the testing focus that we've had here for the past 3 weekends. We know that communities of color are both impacted by higher rates of infection as well as higher risk for complications associated with the infection, with the COVID infection. We know that that's also very complex in why that occurs. But we recognize that access to testing, finding out that an individual is positive, begins that our ability to support them as public health, but then also in preventing spread to family, friends, and the rest of the public. So we have stood up over the past 3 weekends with the help of community organizations, healthcare, and our own internal teams, testing specifically focused on reaching those communities of color. We have tested over 4,000 individuals of within Ramsey County. We are seeing a positivity rate anywhere from 3% to 4.5%, 5%. The majority of those positive, though, are individuals of who identify as Native American, Latinx, North African, or Asian. So we know that we're reaching the right populations. Greater than 60% overall of those being tested are from those communities. There's always we want to see those numbers at a rate that are controlled and not too high, but we expect a rate above that of other populations. And so these are good, reassuring numbers that we're reaching individuals early and we're reaching those communities before the numbers are too high. If we look at the comparison of what we're seeing to Jimmy Lee, which was the previous experience post George Floyd's murder, those numbers were much lower in terms of actually reaching the populations of color and also in positivity. So we do believe that our combined effort to work with community organizations such as Hmong American Partnership, KOM, CLUES, all of those in reaching the communities that are most effective is really helping. I have the specific numbers, if people want the specific numbers that we can share later, but we wanted to just give a sense of the overall effect that we're having, which is exceptionally important within Ramsey County. So I'll turn it back to County Manager O'Connor.
Thank you, Dr. Ogawa, and thank you, Ms. Anderson, for the updates from Public Health. I'll add a few more, and then we'll take any questions from commissioners. Over the last week or two, we have seen an uptick in concerning issues related to drug overdoses and particular strains of drugs that have found their way into some of our shelters, our homeless shelters. And as a part of that, we've been working closely with Hennepin County and our law enforcement partners to work to try and root that out and keep everybody safe. But I wanted to point out that we had a gentleman found unresponsive due to an overdose at Mary Hall last week. And because of the heroic actions of our staff, specifically Art Harris, Megan McFarling, and James Johnson, we were able to save the man's life on the fly. And I wanted to take a moment and recognize the individuals who contributed to one more person still being with us this week. They stepped up into action immediately and administered Narcan and did everything right the way that we should. And I want to thank Supervisor Keith Lattimore for sharing that information with me so I could pass it on today. Thanks again to Art and Megan and James for their work to keep our community safe every day and represent the hundreds of staff working in with Ramsey County or for Ramsey County to serve those struggling with housing instability during this time of need. A few other updates on a rosier note. We have been working quietly or carefully with health partners and one of the large international research outfits working on developing a vaccine for COVID-19. We received outreach last week to be a part of thinking about how we can engage around bridging the chasm, specifically related to culture and linguistically appropriate information, by being a part of their work. Through looking at Ramsey County's work around the Racial Equity and Community Engagement Response Team and our continued focus on testing in particular communities that you heard from our public health staff today, it just goes to show that whether looking around the region or state or the globe, as people are seeking solutions to vaccines and future medical treatments for COVID-19, Ramsey County is a part of those conversations. We're following up with our health systems and the entities who are a part of that vaccination effort. And I just wanted to share that news with you that hopefully we can be a part of finding a solution to this virus. A few other updates. In the food and basic needs area, we've added 3 more food, shelf, and grocery contracts. One for Vietnamese social services to increase capacity of culturally appropriate food and basic need items that will focus on Vietnamese, Karen, Karenni, and Somali residents. HAP, also now working with Hmong farmers to deliver produce to families, as well as with Izarun, focusing mostly on halal food shelves that have several Ramsey County drop-off sites. Over 2,500 meals were delivered this past week from the 15th through the 21st, and we had almost 1,400 unique page views of the home delivery site as well. So as the investment in home delivery and meal delivery is clearly having value, and we'll continue to expand the number of providers that we have being a part of our service to the community. Since August 13th, as we look at our mask requests for our Mask for Everyone program and trying to ensure that everyone has access to masks, we received 2,543 submissions for mask requests from individuals or households, 11 submissions from community groups, and 15 submissions for small businesses. Our first A Mask for Everyone distribution event is aligned with one of our testing events. It'll occur this Saturday, the distribution from 1 to 3 at Oxford Community Center. And we are looking forward to that event and continuing to get these masks out to those requesting them. The good news is that we are clearly finding our way to places in need and individuals in need. We basically used up the supply of masks for the Mask for Everyone program in the first week of the program existing, and we're now working within our incident management structure to add additional masks, because that's a sign that clearly this is filling a gap and a need that has existed, and we're going to continue to make sure we have masks available to support the ongoing need from community. Finally, after 1 week of the service centers being redesigned and reopening, I wanted to share a little bit about that as well. By way of reminder, all 5 service locations opened on Monday, August 17th. Each has public computers called resource centers and on-site navigators and an embedded financial worker. 3 of those 5 sites, Maplewood Library, or Ramsey County Library at Maplewood, Ramsey County Library at Roseville, and then the Downtown Service Center at the East Building, also have workforce service community career labs embedded within their service centers. 7 navigators and 4 supervisors were redeployed into this effort. And after a week of training, we went live last week. 319 residents were served with computer reservations last week. 334 residents engaged with navigators, and I won't read the breakdown every week, but I think it's important out of the gate. 226 were classified as general basic inquiries. 91 were classified as service was provided and resolved. 12 required service to be requested and then escalated, and then 5 were classified as other, and I can't tell you on the fly what other means. Maybe it was a different government service or something else. We'll follow up on that. Topic areas discussed included property taxes, masks, elections, payroll, passports, homestead, community career labs, copies needed, veteran services, recorder's office, and financial assistance services, which generally is what we expected. This navigator role is important to not connecting to one service, but many, and people's lives are not lived in the individual silos we've often had, but through these unified service sites, we begin to recognize the lived reality of how people actually interact day to day. And finally, languages spoken by residents: 234 spoke English, 12 Hmong, 11 Karen, 50 Somali, 14 Spanish, 13 unknown. We're working to adjust our dashboard around service delivery on the open data portal to reflect some of these new numbers and new service options that didn't previously exist when we started to measure before. But I just wanted to share with you some of that information to show how we're being intentional. And just a big shout out to everybody who's been a part of the service design work. We have begun an intentional focus of the transition of that work toward the Information and Public Records Service team, where it will be long-term home and housed near the unified team, which has already come to bear across property tax records and election services. That transition started yesterday. It'll carry with us through the end of the year, similar to the homelessness work, and we'll continue to provide updates here as we go. With that, Madam Chair, Dr. Ogawa, Ms. Anderson, myself, we'd stand for any questions you all may have.
Thank you very much for the update. Apologies for taking myself off screen occasionally. I want to check and see if we have questions from our commissioners, and I will call first on Commissioner Reinhardt, then Commissioner McDonough, and Commissioner McGuire. Commissioner Reinhardt.
Thank you, Madam Chair. I think that the new remote services that we have been providing obviously has been very good as far as testing. I do want to point out to people that clearly if there are symptoms, but even if there are not, that these tests are very important. But it's not like some of the previous tests that we've had, in that you may have to go in and have a test many times, depending on who you have been in contact with. And so sometimes it leads people to believe that, okay, I had the test, I was negative, I'm good. But if you've been exposed or potentially exposed, going in and getting another test is something that's important. And in fact, I know they did that after the civil unrest with the murder of George Floyd, because people came in and then they were asked to come back in a week to 10 days later. So I just wanted to point that out. And I guess along with that, I had a question. When you say individuals, is it individual tests or is it individuals that we are counting?
Madam Chair, Commissioner Reinhardt, thank you for that question. Yeah, it's actually individual tests. We are also making sure that the information that we're giving individuals as we do the testing is just what you had said, because people don't always think about this is just a point in time. And we all live our lives and we're all re-exposed. And so we're telling them you can come back as often as you need to, as often as you are exposed. And we're highly encouraging that people recognize that.
Thank you very much. Commissioner McDonough.
Thanks, Chair Carter. First off, I just want to provide some positive feedback for everybody working on the testing. I've gotten a number of unsolicited, very positive feedback from community members. I got a nice email from a vice president of one of the partners that have been working with us, really calling out the professionalism, the efficiency and effectiveness of the testing. And so I just wanted to pass along, make sure we pass along that feedback to the whole team there. I think it's working out extremely well. And then Ryan, I did have a question. I think you started kind of touching base on it with this partnership here with Health Partners a little bit, but you know, early on, Regions had reached out to us to see if we could help them with some education, and in particular at that time with the Hmong community, because they were seeing such a spike in members from the Hmong community showing up at Regions testing positive. And, you know, we've got a great partnership here with HAP and KOM and our community partners on the testing. Just wanted to touch a little bit it's through that partnership on the testing, are we going a little bit farther and helping with the education within communities so that they really understand the importance of masks and social distancing and hand washing and all those types of things, the gatherings, those types of things? Are we taking it to that next level to really utilize those trusted community people to help with the education of this, to really help kind of stem the tide here, especially in particular communities?
Thanks for that question, Madam Chair, Commissioner McDonough. I'll start and then I'll see if Ms. Anderson wants to add anything from the public health perspective. First, we did follow up with regions after I think I think you were actually the one that they asked the question to first, and then it came our direction. Director Hadeen and I met with senior regions leadership to talk about our experience to date at that moment in time, where we were seeing challenges, to be self-critical of both our own system, their system, and the broader state response. I think only sometimes by being critical do we say, where do we work together? And this conversation around how do we have trusted partners in the community, building out access, particularly at the time to testing, but other resources, was a big deal, because there was a shared recognition that there's only so much trust that you can build up on the fly during a pandemic. If that trust did not exist in advance, it doesn't really matter how well-intentioned you might be at that moment. Those were very productive conversations and have borne fruit. I think in the non-testing environment, our public health staff on the ground, our community health educators, are probably playing the largest role. And I don't know if Laura can answer this today. We did offer as an ongoing resource to regions and other systems the opportunity to engage further with our community health educators along the way to hear more about what we're learning on the ground. Is there anything, Laura, you want to add to that?
I know that our colleagues, our community health educators, have been engaged with health systems, including regions, Health East, many of our federally qualified health centers. We are providing a lot of education at these testing sites. I think that's what makes them distinct from some other testing partnerships that we've been a part of. But I think that clearly testing is going to be one piece of a much larger emphasis around education and building trust. And I think that we can use, we need to be leveraging our existing connections and building them more closely alongside our health systems at this time.
Good. Thank you. Well done. Thank you.
Thank you very much. Commissioner McGuire.
Thank you, Madam Chair. And I just want to add my gratitude for the testing on the weekends. I'm similar to Commissioner McDonough. I'm hearing from many people, almost every meeting I'm in, people are grateful for the testing ability on the weekends. In fact, when they don't live in Ramsey County, they're very disappointed that I'm assuming we only test Ramsey County residents, but maybe we do, but other people are like, why can't we do that in our county? So just want to say thank you for providing that opportunity. I think it brings comfort to our residents and really gives them a sense of, some power over their health situation. I do have a question about, I know this is more recent information about reinfection. Are we keeping track of people if they feel that they've been reinfected with that? I know that that's just something that the medical profession is dealing with right now on whether people can be reinfected. And I just was wondering if we're actually keeping track of those numbers. And maybe that's a question for Dr. Ogawa. I'm not sure if we know anything about that.
Madam Chair and Commissioner McGuire, I'm going to take that question.
You can have it.
I was going to say, I noticed that the looks were towards me, and it is really difficult. We don't have that data yet. We are not specifically looking at the data because collecting that data is really difficult based on the information that we do get from our current testing sites. So our current testing sites, we do get names, addresses, all of those things. We get that information. That information, any positives then are directly turned over also to MDH. MDH is the holder of all of the positives. And I'm sure, as we begin to see, the difficulty is that people can remain positive, since these are PCR tests and not antibody tests, people can remain positive for a long time, even after they're not infectious. So double positives in this case won't tell us whether somebody was reinfected, has remained infected, or even, in reality, is infectious all the time. So we have to then take that, and clinically we have to make a decision as providers of care what to do with that information. As we begin to get antibody testing, that alone also won't tell us, because like other infections, once you have an antibody, it will also remain positive for a period of time. And it's true, the medical community is still arguing on a regular basis about whether or not that immunity or that antibody actually provides an adequate amount of immunity. So it's very complex, but we're all thinking about it, that's for sure. And we're all hoping we will have a little bit more information about that in the future.
I appreciate that. Thank you. It is a very uncertain thing, and I thank you for that response. Showing how, yeah, we're working on it, but it's uncertain. Thank you for that. Just a couple of questions. I think this will be for County Manager O'Connor, because it's with the masks and then with the service centers. Just a question, curiosity on, are the masks that we're giving out, are these homemade masks, or are we able to purchase masks? Or I'm just curious if you're still, I think we are still taking homemade masks from people. Just if you could clarify that, because I still have people wondering what they can do to help if we're still taking homemade masks.
Thank you, Madam Chair. Commissioner McGuire, we are definitely still taking homemade masks. There are collection points across Ramsey County. I cannot recite them all off the top of my mind. The service center sites are some of those sites, but there are also additional community sites, including our Public Works building. I'll ask Sarah Holly or Prince Corbett as our Racial and Health Equity Administrators to follow up with the board, specifically listing the collection sites that you could then share through any means you have. We're collecting those cloth face coverings. We did partner with community to create masks as a part of our first run of the Mask for Everyone program. It was both an opportunity to invest in and support community while also getting masks out the door. We are working on procuring more masks right now through every means possible.
Thank you for that. I just wanted to make sure we got that message out, that we are still taking masks. So thank you. Thank you for affirming that, County Manager. And then very excited about the service centers. I was at a library board meeting, and I'll report on that later. But you know that we are just so proud of our 3 library locations that are hosting the service centers and these navigators. I'm just curious if you, as you were giving the numbers, and I appreciated hearing the kinds of concerns that people have and how they're being addressed at the service centers. Do you have a sense of how many of these were appointments versus non-appointments? I know we're very much encouraging people to make appointments at these, but I know we do take in some walk-ins. And so just curious if you wanted to comment or could comment on some of that we still are encouraging appointments for these, but we do take walk-ins. So,
Madam Chair, Commissioner McGuire, I don't have any more specific data to share today. I'll continue to ask those questions and bring back what I can in future weeks. In terms of appointments, specifically to ensure you can have access to a computer right away, whether for general use or at one of the workforce sites, or to have a time where you can immediately access a financial worker. If you were to call ahead at 651-266-8500, we can ensure that that can happen, which just prevents the need to have to wait. We will schedule with you. However, if you walk in our door, the navigators are absolutely working with individuals as they walk in. And as you heard from the content today, many of the questions people had may have been, 290 of them were things that I think people probably walked in and just asked. I don't think most of those were appointments.
I appreciate that. Thank you for that added information. I'm very excited about this this ability for people to get their questions answered. So thank you.
Thank you.
Thanks to everyone who's doing that work. Thank you, Madam Chair.
Thank you very much. Indeed. Thank you, Commissioner McGuire. And thank you for all of the responses that have been provided so far. I do have a couple of questions. I believe that commissioners who had questions already have had the opportunity to ask them. I'm just looking at the screen to make sure that there are no second questions coming. But I did want to ask also, I've been paying attention to our positivity rate, but as I hear the talk about the 7.6% positivity rate in Ramsey County and the 3.5% positivity rate at the centers this past 3 weekends, I just wanted to ask you to confirm how that works. Does that mean that given the lower positivity that we're seeing, albeit the targeted outreach that we're doing to communities most impacted, does that mean that we could be trending down in our positivity rate against that larger 7.6%? That must be an overtime rate. Could you just explain that a little bit so that I am clearer about it?
Madam Chair, Commissioner Carter would be the same person. Madam Chair, just one thought, and then I'll transition to public health. I don't think we're going to be able to draw that conclusion would be the easiest answer to begin with as you get more nuance. And part of it is who is probably going into health systems to access testing. There's probably a certain level of symptomatic testing already going on, so it's a self-selected sample in a way that broad-based community testing may not have at it. And so just statistically, there's a likelihood that you're going to see higher positivity rates in certain settings as people opt into some types of testing over others. Laura or Lynn, would you like to add to that?
Certainly, Madam Chair. I think what I would like to add to that is when we see these numbers floating somewhere between 3.5 and 5% at our community testing sites, what you are seeing, as County Manager O'Connor has indicated, is clearly that's an audience who wants to get tested. I think that we may also be influenced by other congregate settings in our county that have higher rates of positivity, which will continue to keep that number a little bit higher. So I don't want to raise false hope there.
Yeah. Well, thank you very much for clarifying that for me. And I also just want to very much appreciate the work that is being done across the county in all areas, the testing that you've shared with us, the mask distribution, the service center openings, the partnership with various community organizations and healthcare and others, individuals within our community. And to say a very, very special thanks also for the life-saving work that has been done at our Mary Hall location last week. Certainly, that is an effort that we have to celebrate, appreciate, and know that there are opportunities that we may not hear about where heroic activities are taking place. And thank you to all our staff for their ongoing work. Finally, I also want to thank Ms. Anderson and Dr. Ogawa for appearing before us today. We have seen on a regular basis since this outbreak our Director of Public Health, Kathy Hedin, and we know that it's so much bigger a team and that everyone is attentively working to address this issue of COVID-19 and all of our public health on a regular basis, all of our public health needs and all of our community needs. So thank you so much for appearing before us in Dr. Hedin's absence today, and we hope to see you again soon. I'm looking at the screen and I do see that Commissioner McGuire still has her hand raised. I wonder if that means you still have a comment or question. Great. All right. So we are going to say thank you very much, turning to County Manager O'Connor. If there are any final last-minute comments on our COVID-19 update.
Madam Chair, you nailed the thank you, so I won't repeat them, but it does show that this takes a big team of people to get it done every week, and I really appreciate you calling that out. And the Director of Public Health just sent a text message congratulating her staff as well, so clearly she's watching from afar.
She's not gone.
That's vacation for you.
Okay.
But my
Can
last
you take vacation, Director Hedin?
My last real update, Madam Chair,
Thank you so much.
in all seriousness, is just to say, I think as we hit the fall here, the conversation around flu vaccines and their importance alongside testing is going to really ramp to the forefront. And it's been kind of a conversation that's been sort of there, but we need to realize that the same barriers to access to testing will exist within the exact same communities when it comes to access to vaccinations. and distrust and every other concern. And so I think you're going to see a similarly focused effort from the county working with healthcare providers to be talking about how we get flu vaccines to individuals, because every flu vaccine that prevents flu symptoms helps us prevent what could be a potential concern around a COVID case, which is going to just be a concern all the way around. We started those conversations with our emergency shelter providers as well this week, and it's going to be an ongoing dialogue, but I want to bring it to the forefront of our minds as we leave this topic behind until next week.
Thank you very much. And so we will leave behind then our COVID update with those final thoughts.